So we welcome everyone to this, your Women's Fund Miami-Dade. We really mean it. We're very grateful for your attendance today for this all-important topic. So who's here today? We have an RSVP list of incredible professionals and incredible networks. We have a big ask from your Women's Fund. We know that we have a platform and we are doing our very, very best to leverage it. I know each and every one of you that I saw on that RSVP list also, you can go ahead, Kami, also has a platform, and we're going to ask you to leverage that. That includes our amazing, powerful board of directors. We thank you each and every one, whether you're with us in the audience today or reviewing this on the website afterwards. Your service is absolutely crucial. We had many elected officials and offices of elected officials today with us. We have a lot of representatives from public servants, and we could not be any more grateful to you. Direct service providers, we work in partnership with you, as you know, and please post in the chat who you are, how to be connected, introduce yourselves. This is all about the village. We could not do this work without our pillar sponsors and their investment and their partnership. Health and Wellbeing is supported by the phenomenal individuals and organization that is Citrus Health Network. We are so grateful for all you do day in and day out. It's 10 days of connection this week. I take this very seriously. I actually, connecting is one of my strengths and one of my love languages. There's nothing more important to me today and to this organization that all of you in attendance connect with one another. We are in partnership presenting today with NAMI, National Alliance on Mental Illness, and especially here in Miami-Dade County. And you're going to hear a lot from them today as our panelists. So on we go, Kami. Thank you so much. I'm going to invite our colleague, Viviana Alvarado Pacheco, to show some of the research and data, one of our programs. And also, Viv, thanks for telling us some things that we're not seeing on this data.
Good morning, everybody. My name is Viviana Alvarado Pacheco. I am the Senior Research and Policy Manager at the Women's Fund of Miami-Dade. Last year in September, we launched what's called the Gender Equity Index. It is a score that measures how far we are from reaching gender equity in Miami-Dade County. As part of this project, we have a health and well-being score. So the health and well-being score for 2022 was 44 points. And as you can see in the little graph, we're kind of in that orange zone, not really in the green yet. Some of the metrics that we use to measure the score are health insurance, maternal morbidity, infant mortality, and teenage pregnancy. And one of the full drivers of the score is maternal morbidity, which in 2022, and Kami, you can go to the next slide, please. In 2022 was 24.8, and we saw it rise to its highest in 2020 at 25.3. What Maria is mentioning is actually the maternal morbidity is only considering health as part of the reason why women died or suffered, have bad reactions to the pregnancy. And so maternal mortality goes far beyond that in some of the recent stuff that we've been learning and talking with other partners. So for example, DV-related deaths are not considered when a pregnant woman dies while she's pregnant. We're not also seeing abuse or we're not seeing substance abuse. We're not seeing suicide. So we wanted to point that out. If you want to learn more, however, we do have an entire policy paper on health and well-being where we touch on maternal health. And we also have one on freedom from violence, which also touches on maternal health. So you can scan the QR code and get access to those. Thank you very much.
Thank you so much, Vivi. So physical health is one thing, mental health is another, but they are completely conjoined and interdigitated. getting some of that data. It might be difficult, but we are dedicated to doing it. And we are bringing experts here to help us understand the whole gamut of mothers' maternal mental health, from beginning to end. I've been advised, Dr. Pitas, before introducing you, that I should do a trigger warning for everyone today, because there are very emotional issues when we're talking about mental health, and we're going to be talking about some really tough subjects and tough data today. And so the NAMI Miami line is open, and we'll make sure that that's posted here. And if somebody gets the idea that they would like to speak to somebody about some of the issues and feelings that come up with today, we invite you to please talk to somebody, and NAMI line will be there. Dr. Pitas, we are thrilled to have you with us, and that you're focusing on women and mothers' mental health, excuse me, all day long, every day. We're lucky to have you. Please take it away. I'm sorry we only have 8 minutes.
Thank you, Maria. Thank you for the Women's Fund and our sponsor, Sutras. Thank you so much. It's a real pleasure to be here and an honor. I'm going to give you a quick overview about maternal mental health. It's a passion of mine, and we're on a mission here. Next slide. So some quick facts for everyone. About 1 in 5 mothers are impacted by maternal mental health conditions. And as you just kind of heard, actually, it's the leading cause of deaths, suicide and overdose, and in the first year of pregnancy. And this is something that we really want to get the word out to understand. And of concern also, the highest risk groups are people of color, those that are impacted by poverty, military service members, and military spouses. Next slide. Now, we also know that there are numerous psychiatric disorders that occur frequently in pregnancy, and depression is emerging as the most prevalent among them. In fact, there's about 14.5% of women that experience a new episode during pregnancy of depression, and also an equal amount in the postpartum period. So very common, very important. Next slide. So, and in addition, when you dive down a little bit deeper, unipolar depression, very important. There's a recurrence that's very common. And also don't forget the other disorders, so bipolar disorder and anxiety disorders. Next slide. And so what are some of the contributing factors to poor mental health during pregnancy? So one is if there's a history of psychiatric illness or substance abuse, either with a person, with the patient, or in the family, or these prior experiences of sexual, physical, or emotional abuse, and ongoing exposure to intimate partner violence or coercion. And of course, existing social challenges and concurrent adverse life events. Next slide. Now, you saw that peak, right? 2020 or so. So we can't leave that issue. And I just want to sort of touch on this a minute. And so we use the term PASC, which is post-acute sequelae of SARS-CoV-2. So COVID, very important, right? The pandemic. And actually about 9.3% of pregnant women have PASC that have been infected during the course of pregnancy. And when we take a deep dive on this, this is really recent data from a large network study. Pre-existing depression or anxiety disorder are amongst the highest risk drivers for all of this, of developing it. So very important to keep in mind. Next slide. Now, can you go back one? Thank you. So now, not only is there the mental health consequence, but there are other consequences about it. So what happens? So it looks like there's a correlation with insufficient prenatal care, low birth weight, and prematurity. And then when you think about the postpartum period, there's a concern about a problem with bonding with your baby, neglect, and hostility toward the newborn. Next slide. Now I'm going to sort of touch on one of the original comments in the opening slides, which is about mortality. Okay, so one is you kind of understand now that mental health conditions, they are a primary underlying cause of pregnancy-related mortality. And from what I just showed you, also morbidity. Now, when we think about maternal mortality, our rate is about 2 to 3 times higher than other high-income countries. And this rate, until like just recently now, has been on the rise. We may be seeing a little bit of an improvement here, a small improvement of very recent data. And don't also forget that maternal deaths, about half of them or more, are occurring between 7 and 365 days after childbirth. And the issue for us is that 80% of these fatalities have been deemed preventable. Next slide. So when you look at the buckets of what are the drivers, the causes of maternal death, here you see mental health conditions. They dominate, followed by things like hemorrhage, cardiac disease, infection, blood clotting, cardiomyopathy, high blood pressure disorders, and then a grouping of a variety of other ones. Next slide. So what can we do about it? You know, there are some strategies, effective strategies, and it's important that counseling is at the center of all of this. So very important. So to prevent one of the most common antenatal drivers, that postpartum depression. So, and then when you think about counseling interventions, well, what's in the toolkit? So you have cognitive behavioral therapy, interpersonal therapy approaches, and they've been effective in reducing almost about 40% in the likelihood of having a perinatal depression. Whereas if we don't use the counseling interventions, it's not as effective. So again, counseling, so connection, really important to drive this down. Next slide. So these interventions, right? So we need early detection, so important, and then effective management of these perinatal psychiatric disorders, really critical for the well-being of women. They have so many other stressors that can be going on, sleep deprivation, etc., new experience that can also impact. So we want to screen during pregnancy and in the postpartum period, and then intervene when appropriate. Next slide. And so we've really targeted this, and you may hear a little bit more about it toward the end, but I put this as a center point for us in our health system here, that we target this issue. And we're very thankful for the foundational support that we have from the Scafie Foundation. Next slide. And so, you know, what we're doing this past year and moving forward is we're offering a program for all our patients where they're coming in, whether it be through the portal of a triage on the labor floor, or the labor floor itself, or the neonatal intensive care unit, or our high-risk antepartum units, or the postpartum units, or the University of Miami outpatient, or our Jackson clinics. Next slide. So we're trying to cast a wide net. And what are we doing? We took an approach this year where we're combining basically the Edinburgh Depression Scale, another prenatal psychosocial profile, and a few others, really to get at some of the stressors here. So so you see the PHQ-9 and also the GAD-7, and there's some sort of scoring related issues to it. But the point is, it's multi-dimensional, and we're screening 3 times in pregnancy, in the start, at delivery, in the postpartum period. Next slide. And then, you know, just we want to make it accessible. And so this is our approach. And you may hear from Georgia Castro, our mental health counselor that's leading the effort in this here. And so we have QR codes. We have easy ways to get a hold of people. This is really important. Patients need this connection, and we want to be offering it here in collaboration with all of you and your societies and foundations. Next slide. And if you want some references, they're there as well. And next slide. And I'm about 13 seconds over. So thank you so much. There's my contact info, and also George's as well on the next slide. So thank you. Thank you. It's a pleasure, and I look forward to working with all of you. Thank you.
Thank you, Dr. Paidas, for what you do every day and for being with us. There hopefully will be time for Q&A at the end. How many of you were at Power of the Purse? Raise your hands. If you were there, I know that you know that the Women's Fund is always about you, and you. And as I said earlier, We have a platform and we know it, and we know who you are and that you have platforms. So when you come to an Impact Collaborative every month, you are here for two things. Well, maybe three, maybe to find your tribe, maybe that's one, but you're here to find out what you need to know, what's going on with women and girls in our community. What are the issues? And most importantly, what can you do about it? Today, you will have both. You'll find out from our panelists what you need to know and what you can do. We ask you to participate. This Light Power of the Purse is a participation sport. We'll be conducting 3 polls. Hopefully you've done it now while I am blabbering. And we're going to connect 2 more. We'll also ask you to give feedback as soon as this Impact Collaborative is done. There'll be a survey, and we use those comments. It informs our work. It informs what we do. We also look for quotable quotes. So please participate and be active in the chat. Please do. I will say, speaking with some of the panelists this morning, I'm a mom for life. I'm 62, and I thought about my own mom, and she's still my mom, even though she's no longer on this earth. So we're asking everyone to introduce themselves today as a panelist in their area of expertise, helping all of us to, whether we have a mom, which is all of us, or we are a parent or are contemplating being a parent. This affects all of us, and we ask them to give the knowledge that they have, the expertise that they have, hands-on brilliance. So introductions in 2 minutes or less, because it's only about why you're invited here today. Let's go on first. Dr. Shannon, thank you so much for being with us. Take it away.
Hello, it's a pleasure to be here today to discuss the topic of maternal mental health. Thank you to the Women's Fund for inviting me and including me on the panel. My name is Shannon McGranahan, and I am a retired OBGYN who practiced for over 20 years in Pittsburgh, Pennsylvania. Whenever I would share my occupation with people, I'd inevitably get the comment, "Oh, what fun, you get to deliver babies." But what they failed to recognize is that pregnancy and birth are fraught with potential traumatic outcomes, which have significant and long-standing impact on maternal mental health and well-being. Personally, I vividly remember and keep in touch with a patient who opened my eyes to the perils of perinatal and infant loss. Heather was pregnant with her 3rd child and was given the diagnosis of a lethal condition. She had to navigate pregnancy with the terrible knowledge that her child would not survive after birth. Ironically and heartbreakingly, I delivered Heather's little boy, Patrick, on my oldest son's birthday. Patrick would be 7 this year. As an obstetrician and a mother, helping Heather and her family navigate the difficulties of pregnancy loss had a profound effect on me. Fast forward, for family reasons, I relocated to Miami a few years later, and fortuitously, I met Mindy Cassell, the co-founder of the Children's Bereavement Center and Lift After Loss. The CBC was starting a perinatal and infant loss peer support group, so I pivoted from clinical practice to focus on maternal mental health, particularly in the setting of loss, and I trained as a facilitator, and I've been leading the group since its inception 4 years ago. Motherhood is fraught with complexities and challenges, and maternal mental health needs to be a priority in our communities, as mothers are the gatekeepers of the family unit. I look forward to sharing some insights of the key issues, the challenges, and the potential solutions facing perinatal and infant loss in the context of maternal mental health. Thank you for having me here today.
Thank you, Doctor, very much. And now I'm going to ask a wonderful community partner and community leader, Tanisha. Please take it away. And we have you on mute.
Sorry, my mute. Okay, sorry. Good morning. Thank you so much to the Women's Fund for this invitation to serve as a panelist on this great topic we're talking about, because it needs more attention. So my name is Tanisha. I am the Director of Maternal and Infant Health and Collective Impact with the March of Dimes. I'm here because the work that we do is centered around education, advocacy, and research. Overall, we really have a goal to reduce preterm births and maternal mortality. And as Dr. Paez spoke earlier, it really is one of the leading causes of maternal mortality and morbidity. So we really want to use the data using an equity and social drivers lens to really work to strategize and how we can combat the issues that we're seeing in the community. We plan to do this by using data to mobilize the community and focus on action-driven results. My area of expertise while I'm here is really focused on community engagement, health equity, and expanding access across care. So I really appreciate it, and I look forward to hearing from the other panelists as well.
And now I'm going to ask our 10 Days of Connection partners, NAMI Miami. Miriam, please introduce yourself.
Good morning. It's an honor to be here. Thank you to the Women's Fund also for inviting NAMI to be here. And thank you, NAMI, for giving me the honor to share my lived experience. I am a teacher of 27 years for Miami-Dade County Public Schools, and I catapulted into my purpose and why I'm here to give all mothers hope for a better tomorrow, for us to level up to our best selves, to show up for our families. My story truly starts from the age of 5 years old, having to be the mother of several different people in my family unit due to alcoholism and mental health. My story ultimately comes from my oldest son, who at his worst was diagnosed schizoaffective bipolar. I wish that I knew then what I know now, that we are responsible for creating our safe space, that we have community organizations to support us in the challenges that we face, that oftentimes we're so embarrassed to share, that our family members are going through such challenges. I'm also the daughter of a mother who's OCD. I have a schizophrenic nephew. I myself have gone through anxiety and depression in the difficult times. In my worst, I was diagnosed with fibromyalgia, which was as a cause of not knowing how to reach out to the community, how to reach out to loved ones, and how to care for myself in the different gamuts of being a mother, not just to my own children, but to the family around me. I thank everybody for being here. This is a plethora of information, and look forward to sharing some more.
I'm going to say once again, for those of you who've just joined us, we are giving fishing poles here, not just situationals. There's some trigger warnings here. There will be some intense information that will be shared today. And the NAMI hotline, 24-hour hotline, is there if you feel like you'd like to talk to somebody. Okay, so please, let's go back. What do we need to know very particularly on the issue of the very pre that you're addressing, Dr. Shannon?
Thank you. So what are some of the key issues in challenges? Well, first of all, we need to talk about prevalence. Perinatal loss is a relatively common occurrence, and it refers to the death of an infant due to miscarriage, stillbirth, or neonatal death. In the United States, we have about 24,000 cases annually. 10 to 15% of confirmed pregnancies do end up in miscarriage. Stillbirth happens about 1 in every 160 pregnancies. Neonatal death before 28 days of life occurs at a rate of 3.6 per 1,000 births. And Black and brown women and women who come from low socioeconomic background have a higher rate of loss during pregnancy and infancy, as we heard earlier. What are the challenges that these women experiencing these traumatic losses face? Well, they have isolation, limited support, and understanding of what they're dealing with. Perinatal loss is often sudden and unexpected. Pregnancy screenings, 3D ultrasounds, the feeling movement of the fetus makes it seem like a baby. It is a baby. As a result, grief after a perinatal death does mirror the grief experienced after the death of a loved one, even if these mothers haven't met their child yet. Common feelings experienced include shock, profound sadness, depression, anger, irritability, anxiety, and changes in eating and sleeping patterns. Perinatal bereavement can involve feelings of biologic failure. Somehow she failed, her body failed. She couldn't keep her child. She couldn't protect her child. She didn't eat well. She didn't sleep enough. She didn't exercise properly. These all lead to feelings of isolation. She certainly experiences loss of identity, particularly if this is her first child. Is she a mother? Can she consider herself a mother if she doesn't have a child? And in reference to how we refer to these individuals, when we talk about a child who has lost a parent, we call them an orphan. When we talk about a spouse who has lost a loved partner, they are a widow or a widower. We don't have a word to describe the mother who lost her child. She has sadness over the lack of memories with a new baby, and she has concern for the future. Can she get pregnant again? Will she get pregnant again? Will this happen again? Will her body fail her again? For many women, perinatal loss and grief can trigger higher rates of depression, anxiety, and other mental health problems that can be long lasting. We heard that in the introduction. The emotional distress of pregnancy loss can continue even into subsequent pregnancies and the birth of a healthy child. These women express experiencing limited support. Grief and bereavement are individualized processes that do not follow a standardized timeline. Yet bereaved parents are often subject to hurtful and unhelpful comments. The mother may hear, "Move on, get over it. You'll get over it." They may hear, "At least it wasn't an X-year-old." At least, any comment that starts with "at least" negates what she is experiencing. They hear, "Be thankful you have or can have other children." Like the child that she lost is not relevant. In the case of miscarriage, we hear, "You weren't very far along." And loved ones may be unsure of how to approach the family, resulting in feelings of isolation or disenfranchised grief. Parents who experience perinatal loss commonly cite regret at not creating enough memories surrounding their child. They specifically mention not holding their child long enough or even holding their child at all. They mentioned they didn't look closely at their hair, their hands, their feet, their eyes, and most importantly, not taking enough pictures or any pictures. Nurses who work in perinatal loss and bereavement have described the work of caring for these couples as uncomfortable and challenging and overwhelming. So obviously their own difficulty in dealing with this situation has a profound effect on the support that the bereaved mother feels. After a baby dies, mothers and fathers deal with a multitude of emotions that span an unpredictable amount of time, yet follow-up support for perinatal bereavement often remains inadequate. Think about the postpartum visit. She's sitting in a waiting room with other pregnant mothers, with mothers holding their newborns, and she's there for her health and well-being, and she's lost a child and is faced with this full on. Another common social icebreaker is, how many children do you have? How do you answer that question? Whether you just lost your child or it's 20 years later and you have 2 other children, how do you answer the question of how many children do you have when you've lost a child? It is critical for everyone to understand that after a loss, the mental health and physical health of mothers and fathers may be impacted, and support should always be offered indefinitely. Thanks.
Thank you so much, Dr. Shannon. And again, we will be coming in the next portion to what we can do about it and the support. Tanisha, please take it away.
Yes, good morning. Thank you for that. I really just want to briefly just kind of highlight a couple of the numbers, just looking at the numbers a little bit deeply, especially the disparities that are seen. In the US, the data indicates that 4 million people who give birth each year in the US, and at least 600,000 women will develop perinatal depression each year, and those numbers are actually far higher when you include other mental health disorders. As you can see here, 75% of individuals who screen at risk for postpartum depression, they remain untreated. So this is definitely a gap here. Maternal mental health symptoms, we're just coming off of Black Maternal Health Week at the end of April. So I really wanted to touch on the disparities that we're seeing. Maternal mental health symptoms and issues among Black women are often overlooked and underaddressed. As we know, racial disparities are all well documented. In the diagnosis and treatment of maternal mental health, 40% of Black women experience maternal mental health symptoms, nearly twice the rate as all women. And up to half of them don't receive treatment. They don't receive support, they don't receive treatment. And this is actually far higher than white women. And this is usually because they're less likely to receive treatment due to factors like fear and stigma. Culturally, the cultural makeup is also, we have to keep that into consideration when we're thinking of strategies to assist the community. Some things are still taboo. Like I said, the fear of the stigma being associated with seeking out that help. Financial barriers is a large part. I think we touched on that a little bit earlier. You know, affordable mental health care is also important. Most people of color that we have seen, that we have worked with, find that it is very challenging to obtain mental health services at an affordable rate. And so that again leaves a barrier. And so when we look at all these factors that play a role, you know, left untreated, these illnesses really have a long-term impact, not only on parents, the babies, but also just the family as a whole. And then furthermore, of course, this is going to affect society and how we move forward and how we flourish. So also just highlighting a little bit more here about the risk factors for perinatal depression. It was discussed earlier, so I won't, of course, belabor that topic. But I just wanted to highlight that, birthing persons find it difficult to access treatment in perinatal mood disorders due to lack of time, especially being a new mom. I can vouch for myself. You really don't have time. So, not only time, but certain things like language barriers, unaffordable mental health care, like I said earlier, and also lack of access to quality mental health care. Now, that's the other thing, but that's a whole nother longer topic about quality mental health care, right? So we not only want access to mental health care adequate, but the quality that's there as well, okay? And even for half of women that are diagnosed with postpartum depression or perinatal mood disorders, a lot of them, it's their first time having depression. And so we really want to make sure we're addressing this gap and filling it in where it's needed, where we can assist. Next slide.
Tanisha, the rest of the slides are in the solution section.
Oh, okay. So really, I just wanted to highlight those risk factors because, of course, as you know, these risk factors are exacerbated for people of color, and we really want to highlight where those gaps are. So again, like I said in the beginning of my introduction, really focus on health disparities and where we can really improve the screening and treatment of services for the community. Thank you so much.
Thank you, Tanisha. Miriam, representing the rest of motherhood, which is forever. Take it away.
It's funny you should say that. Thank you to everybody who's been on here sharing such important topics and truly the fact that we don't talk about these things. We don't talk about mental health, right? So I'm here representing NAMI, and we have many different programs, and they've been like my lifeline, my oxygen tank. And I know that we're working on so many other programs to reach our community. I can go through the aspect of a teacher and seeing our children coming in as parents of their own home. And it's not just our children and what we can provide within the school system. I lived it. And now coming onto this platform, I realize all of the things that I needed throughout the years that I've learned now into how we can better support ourselves in facing challenges of mental health. I've recently experienced becoming a grandmother to an angel and to a little 5-month-old. And I've seen what my daughter-in-laws have been through the worry about, am I showing up enough for myself, for my husband, for my children? Something that I went through. I don't know if I mentioned earlier, I was a teenage mom at the age of 17, and that's where my story of mental health mostly comes from. But it wasn't just from there, and I kind of keep on going back and forth. As it's mentioned, I'm kind of covering the gamut, right? And bringing on my own personal experience. And I shared earlier, I became a mom at the age of 5 because my parents didn't know what to do in the face of mental health and drug and alcohol abuse for my older brother. I was the one who did recovery for him. And life kind of knows sometimes what to put our way through our professions and our lived experiences. I've been able to participate in many different support groups to assist me along the way, because again, as women, and this is an important key point that I would love to share and for everybody to listen and take with you, are we asking for help? Are we letting others know that we need a shoulder to cry on? Are we letting others know that we're in need of support, that we're scared, that we don't know what else to do? We don't get taught that. We don't get taught to address our emotional, mental, spiritual needs in navigating the realities of being a mother. I became a mother at 17, and then I was married at the age of 23 in an abusive marriage, couldn't get pregnant again, struggled in getting pregnant, and then had another son. And both my boys at different aspects of life were faced with depression and anxiety, and mental health diagnoses and symptoms. So what do we do as moms? How can we give? We end up just giving, providing, going to work, creating meals, and whatever our social expectations tell us that we need to do. But we need to fill our cups. And that's why it is an honor to be part of this organization of NAMI. Like we all know right now, if we're triggered, we can pick up the phone and call the helpline. We have weekly family support groups, peer-to-peer educational courses where we're taught on how to show up and validate others and being empathetic. And it was said earlier how we say, well, at least this, and at least you did that. And that's not showing comfort to others. I love to mention how we can come and talk about our physical needs, such as maybe having a family member with diabetes or a family member with a heart condition or cancer. And many times in those spaces, we have the support. But when it comes to mental health, when it comes to waking up every morning not knowing what to do with our child, when it comes to our own depression and anxiety and things that we face that we don't talk about, we don't allow for others to help us. And that's what we need to break, the silence.
That's what we're all about today. And so now the most important part, the fishing pole. What can we do? And that's the exciting part. Participate, please, in the polls while we ask Shannon to give us solutions. What can we do in 3 minutes or less?
Right, thank you. So what are the potential solutions, particularly surrounding support for perinatal and infant loss? At the Children's Bereavement Center and Lift from Loss, we believe that empowering healing through community and education is a solution. The philosophy of the CBC is grounded in research and best practices for addressing grief and bereavement, as well as healthful adaptation to loss. To achieve these goals, the CBC developed and utilizes its healthful grieving model, which includes the following principles. Grief is a personal journey. We heal at our own pace. Intensity and duration of grief is unique for each individual, and the power of a supportive environment cannot be emphasized enough. The new Surgeon General Advisory last year came out with a piece that raised the alarm about the devastating impact of the epidemic of loneliness and isolation in the United States. The advisory is highlighting how connection plays a critical role in individual, community, and societal health. And here at the CBC, we embrace that thought of community and support. So how do we support these bereaved parents or mothers? You need to create a space for people to share, for mothers to share, acknowledge her motherhood, validate her grief, allow her space not to share if she prefers. Very important, refer to the baby by name and recognize him and her as an irreplaceable individual. Recognize their birthday, recognize Mother's Day, include the mother in all these activities that you would with other children. Employers can support bereaved parents by showing compassion, taking a caring and interested attitude, and allowing a phased return to work or other accommodations. At the CBC, we espouse the principle that connection is paramount to the grief journey. Joining a support group can offer immediate emotional relief and a sense of community. Joining a pregnancy loss support group might not sound like something you're interested in doing right after experiencing such a difficult event. Nonetheless, sharing your feelings with other parents who understand your experience can create a unique bond that validates your grief and provides a safe setting for everyone to express their emotions. Talking to others gives reassurance that your grief is normal reaction to the deep sense of loss. The CBC peer support grief groups are therapeutic. They're not therapy, which is helpful for participants who are at least initially wary of mental health services. The CBC support groups are free and open year-round on Zoom to moms and dads who experience a loss. And as previously mentioned, the US Surgeon General has highlighted the importance of social connections and mental health programs as a frontline response to address loss, underscoring the very essence of the Children's Bereavement Center and Lift from Loss and the grief support groups that we offer. So I've shared with you some information about our support groups. If I could have the next slide. No? All right, well, here are information about some of our support groups, but specifically our perinatal and infant loss grief support group. Again, support, community, these are the pillars on which we help these women experiencing such a difficult time as pregnancy and infant loss. Thank you.
Thank you so much, Shannon. We may have a little technical difficulty there. Sorry about that. The next
No
slide.
worries.
Tanisha, please give us the fishing pole. What can we do?
Yes, you know what? I actually will keep mine short and sweet. We really just want to ensure that, we're highlighting that fact that mental health is essential for every parent. To best care for your baby, you really need to be healthy and focus on your mental and physical wellness in order to be the best parent possible. We sometimes think as parents like self-care is selfish, but isn't anything but selfish. It's actually selfless because you have to take care of yourself in order for you to take care of your child as best as possible. So the more time you attend to your basic needs, the more time you'll feel better about yourself and then the life that you have as a new parent. Really, we are challenging everyone to advocate for policies that improve access to mental health care and screening and treatment. And really, we just want to highlight that it's time. It's time to take action to address the maternal mental health and the disparities that are present that I mentioned earlier. And we're calling on healthcare providers to increase access to screening, support, and treatment for mental health conditions for all, but especially for people of color.
Thank you so much, Tanisha. And Miriam, we're going to ask you to give us a quick overview from Motherhood Big Picture, and we've got lots of great questions. So give us a fishing pole, please, and then we're going to go to the Q&A.
So exactly, I'm going to piggyback really quick on Tanisha, right? Showing up for ourselves in many different ways. NAMI provides a helpline that is available throughout the week. in any kind of a crisis moment, and they provide resources because we're linked with many different organizations within the community. Next slide, please. So all of our programs and our support groups are for free. We have peer-to-peer support groups, we have family support groups, we have support groups for spouses of people who are going through mental health. We also have courses that give us good indications on how to navigate the mental health world with our family members. So I invite you to jump on to NAMI.org. There's also mentors when you call the hotline that will support you in navigating these challenges. It is amazing to link with a community and other people that are going through the same thing, and how together we can catapult to a better society.
Amazing. We're going to ask Dr. Paidas and Georgia Castro also, who Dr. Paidas mentioned before, to join us now for the Q&A. Incredible questions here. Some of them are on the Q&A, and other ones are being texted to me and all kinds of stuff. So I'm going to start with the first one. Children's Movement of Florida, Rocio Velasquez asked an amazing question. Many mothers are afraid, scared of asking for professional help, or even share that they're not feeling well emotionally during pregnancy because of the fear of being separated from their babies. What a fear. What are your thoughts about how to handle this and how to help them feel supported instead of threatened? So who would like to volunteer to take this first?
I'll volunteer, and then I'll ask Georgia if she wants to chime in, and the rest of our panelists. Super great question. So on the care provider end, we have to be proactive. We have to ask our patients. So by us bringing up the topic, it kind of diffuses all of the issues, I think, that are the stigma that's associated with it, or it can help for that. And then reassure for the patient, like, no, it's so important that we, connect the dots, connect the patient, connect you with your baby, maintain that connection, so important. And all of the other things that we're doing also help that mother-baby bond that are unrelated to the mental health, but that support that whole union together. So important. So yes, it's on us to help our patients.
I agree, Dr. Paidas. I think you said it well. It just the physicians bringing up the need for the assistance, the need for the bonding, and because it is such a confusing time for moms, that just being proactive, I think, is what eliminates that fear, allowing us to guide them more in that time that they're so critical.
Terrific. Anybody else on the panel want to address that one before we go on to the next?
I would say that as a community, we need to ask each other, how are you doing?
Mm-hmm.
And hold hands and not be afraid, because once you show up, that brings down their guard.
That's, I think, one of the probably the biggest message of us being here today, right? Those statistics say we all know somebody. We might not know we know somebody, but we do. Next question comes from Audrey. How often are you administering the screening to mothers? And are you administering in the perinatal period and the postpartum period both? I would say that would be for you, Doctor.
Well, thank you. And also, since Georgia is really on the front lines doing it, but so our thought was we want to get it before, like, when a patient is pregnant, and we even have it even before, like, preconceptual too, but let's just say, so for pregnancy, at delivery, and then postpartum. So 3 times at the minimum. That's our goal.
Terrific. Miriam, I'm going to go with you. The next question. There's a question. Is NAMI only available to residents of Miami-Dade County?
No, all of our Zooms are available if you go on NAMI.org, and they can jump on virtually to all of the supports, and the hotline also is available.
Nikki, I'll say nationally, NAMI it covers everywhere. I mean, I'm 62 and my mom had bipolar disorder. So when I was a kid, I got pamphlets from them. There's rich resources. So it's not only the hotlines, but also there are all kinds of studies, pamphlets, handouts, it's really rich on the website. And I know that a few other people, Lindsay and a few other people have posted some great resources also on the chat. So terrific. Another question for Has thought about possibly providing experts who can screen mothers to local nonprofits who are already working with mothers as a part-time pro bono services monthly or even quarterly?
Oh, that's a super good idea. You know, I've been here now 5 years in Miami, and I love being here. It's my home, our home. One thing that we're doing, a number of initiatives that we have are reaching out into the community. We continuing are trying to go out in the community to partner out there. We have a new doula program here. There's so many different interventions that we're targeting. The hypertension, you know, the blood pressure related issue postpartum back in the community. All of these things so important. I welcome your engagement. Text me, call me, email me, and to Georgia as well. We're happy to look. We might not have thought of everything, but we have a lot of outreach. We, in fact, have a very large NIH study now called Miami Echo. It's a landmark study, 7 years, where we're looking at childhood influences, looking at mother-baby dyads and how that impacts the child development through these various pillars. And it's all through the community. That's where the patients are coming in from. So we are engaged, and please reach out. And we work with a lot of the community providers and clinics. So thank you.
This is terrific. And we have, we have private providers in the house. We have a lot, Baptist Health is here with us today. I mean, I think these are the questions that you can ask of all of your providers, public and private. We have a lot of community partners here with us today. And as we always say, it really takes the village for being on speed dial. One of the polls that you are being given today is if you'd like more information from one of our speakers today. So please know that these resources are supposed to live past today, strong today. This will also be posted for replay on our website, on YouTube. You can take any piece of it that you want, show it to your groups, folks in the audience, and expand this to your networks. And if you have a question later, a lot of our panelists today are gonna allow you to ask those questions and direct you to resources. So we have another question on the side here. So it's been mentioned several times that one who's not experiencing the issue, right? It's not the birthing person, but those surrounding them. How do we handle it? Can we call the Children's Bereavement Center, for example, and say, I have somebody in my circle who has experienced this? And I'll use myself. I have somebody who's in my inner circle who has had issues that you've addressed today, Dr. Shannon. How do I learn on how to support her best?
So we have educational seminars that programs can solicit the Children's Bereavement Center to come help their organization understand grief and bereavement and how to support any individual in their corporation or organization on how to support these individuals experience grief and bereavement. That's on the education side. As far as the individual, we have support groups that run the gamut from adults who lost anybody. We have services for elementary school, middle school, high school aged individuals. The perinatal and infant loss group is specific to the parents who lost a child, but we also have a larger support group for anybody who lost any child at any age. And as far as how they get there, it's self-referral. You don't have to refer, you don't need a referral from a health professional. The information I included in the webinar chat on how to contact the Children's Bereavement Center, reach out to our intake line. They can guide you in the direction on how you can support somebody who's experienced a perinatal loss.
Thank you so much. And Miriam, I'm going to ask you across the lifespan. I mean, I have stressors as a 62-year-old mom, right? Is NAMI there, and are there any charges for this service?
All of our services are for free. You can call the hotline and you're provided with a mentor, which can link you up to many other community resources. So that's one. The other thing, and somebody mentioned it on the chat, very important, not just is there a hotline, but 988 instead of 911 directly links you to a team that is ready to help with any kind of mental health issues or crises. Okay, they could even come out to your home. So that's something that we promote through NAMI as well. Our support groups are weekly. So it's not just for people who are struggling themselves, but supporting the family members of those who are struggling, right? Again, community is power. There's no I in team. And our family to family courses also provide a plethora of information on what mental health is and how to deal with our family members. Because oftentimes we don't know what to say to each other. We don't know how to support each other. And so the question was, can we show up as family members? Absolutely. That's why I'm here, because there is hope. We're here to help each other.
Michael, I know I can call you Michael. We have pre-interviews with everybody. That's why these panels are so amazing, because we try and really learn what we have to make sure and ask you. So, Doctor, there's a question here. The Women's Fund has been looking, especially, we look at data, as you saw Viviana before, and nationwide and internationally, the United States is not the top of the barrel as far as maternal outcomes, right? Health outcomes, maternal mortality, morbidity, infant mortality, and infant morbidity, right? So we're looking at these things. We're trying to find solutions. So we see the statistics, we know it. Then we try and bring it to Miami-Dade. What can we do about it? What are the trends in the medical community, the thought leaders looking at incorporating not only the physical health, but the mental health of birthing people and children to try and improve those stats, not only in public health, but also in private health, in healthcare in general?
Yeah, great question. And it's a challenge. But first, it's an awareness. So the docs, the care providers have to understand that this is a problem. Number one, we have to listen to our patients. We have to break down barriers. We have to stop the structural racism, and we have to connect with patients, not see through them, but work with them on their journey together. It's all about the patient and their family. And we have to provide resources when we uncover things. So the data, well, that's one reason why we're screening 3 times in mental health and pregnancy, because we need the data. We need to understand what's going on. And we have to understand that, we might have a mental health issue, but we also might have a patient that is homeless. And, there are so many issues and so we have to take a holistic and sort of societal, local family approach to kind of helping our patients, right? And we have to be engaged with the community. And our foundations and supporters out there who want to do great work, we have to partner together to make sure that we get these resources to the patients, right? We need more physicians. We need more advanced providers here. We just need a lot here in local area in Miami. And the translation, it's so important. The language, you heard that from the very beginning. We need to communicate with our patients in their native language. We need to make sure we have enough Creole translators, etc., or whatever language it is. Very important. So we are making strides, and it's on us to actually, connect with our providers out in the community and our partners.
Well, it's incredible that the attendees came today and are going to be able to leverage the what you need to know and what you can do, right? To really support our community members. It's incredible. We thank you so much for participating. You can volunteer with us even more if you want to be an impact agent. If you want to join one of our committees, you can help measure our impact by joining our research committee or our advocacy committee. You can really help our impact by donating and fueling our mission, whether it's large or small. Philanthropy is philanthropy. It's, focus is an incredible thing, and donating is super appreciated. And you can come back every month. Our next one's a little bit different. This is our annual collaborative with many community partners. We're doing a hybrid training on how to advocate. So learning about advocacy, what the basics, 101, what you need to know, how you can work to advocate locally, statewide, and federally, and then what you can do, whether you're a nonprofit or an individual, to have your voices heard. So we thank you so much. Please join us 9 o'clock a month from now virtually. And in person, we're going to give you breakfast if you come to the Maurice Ferré Institute for Civic Engagement. So thanks again for completing the exit survey. You are important, and we appreciate you. Have a wonderful day. Thank you so much, panelists. This is amazing.
Thank you. Thanks, everyone. Super job. Nice to
Thank
meet
you.
all.
It's a pleasure.
Right, we'll connect.
Looking forward to
We'll keep
staying
the connection.
connected. Looking forward to
Thank you,
staying connected.
everybody.
Let's
Yeah.
change those maternal and infant mortality and morbidity stats here in Miami-Dade County.
Right, we'll do it
Shall
together.
we?
Great.
Thank
Wonderful.
you. Thank you, team.
you.
Tommy,
Great.
Viv, Natasha, Isabella, everybody.
Thank you.
Appreciate you. Thank you, board members.